My dear friends, so today we're going to do the ninth model paper for PSC exam, okay, Assistant Dental Surgeon exam, upcoming exam. This question paper contains 100 questions just like the PSC exam, and this question paper can also be used as a model paper for NEET MDS exam, upcoming exams of 2026. So please revise these questions, it's very useful. So let's begin without wasting time. So the first question is asking about cytochromes. Okay, cytochromes are what? They are pyridine nucleotides, riboflavin containing nucleotides, metal containing flavoproteins, or iron porphyrin proteins. Okay, cytochromes are actually iron porphyrin proteins. Okay, option D is the answer. Cytochromes are iron porphyrin proteins. Okay, cytochromes are iron porphyrin proteins. Second question, in TCA cycle or tricarboxylic acid cycle, which is first formed? Isocitrate, citrate, succinate, or fumarate, which is first formed? So in tricarboxylic acid cycle, the first formed is actually the citrate. Okay, citrate. Question number 3. Beta oxidation of the odd chain fatty acids produce succinyl coenzyme A, propenyl coenzyme A, acetyl coenzyme A, or malonyl coenzyme A. Beta oxidation of the odd chain fatty acids produce what? Propenyl coenzyme A. Okay, option B is the answer. 4. The vitamin that facilitates iron absorption: folic acid, ascorbic acid, biotin, or para-aminobenzoic acid. The answer is correct. Easy. B. Ascorbic acid. Okay. The vitamin that facilitates iron absorption is ascorbic acid. Fifth question. In myocardial infarction, the first enzyme to rise is CPK, LDH, SGOT, or amylase. In case of myocardial infarction, the first enzyme to rise is actually CPK. Option A. Now, question number 6. Noguchi's medium is used for which organism? Bordetella, Brucella, or Borrelia? Okay, Noguchi's medium is used for mainly Borrelia. Okay, C is the answer. 7. Diphtheria is pathogenic only when infected with beta phage or alpha phage or lambda K12 or delta phage. Okay, diphtheria is pathogenic when it is infected with the beta phage of the organism. Okay, diphtheria, B. Okay, option A is the answer. Beta phage, you remember. Question number 8. Botulinum toxin causes tachycardia or involvement of the cranial nerve, or fever or hypertension. Okay, botulinum toxin actually in case of tetanus. Okay, it causes what? Cranial nerve involvement. Okay, so bilateral cranial nerve involvement. Question number 9. Which of the following viruses are most likely to cross the placenta and cause the fetal defect? Herpes simplex, mumps, rubella, or papilloma? Among the given options, rubella is the one which causes placenta and can cause a fetal defect. If mother is infected, the child also gets affected with rubella. There will be developmental defect because of this infection. Okay. Question number 10. Colmer test is a screening test done for syphilis, tuberculosis, gonorrhea, or lymphoma. Colmer test is a screening test done for syphilis. Okay, not so common, but it is used for syphilis. Okay, Colmer test for syphilis. Question number 11. Illuminant fibers are found in which area? In gingiva or cementum or alveolar or periodontal ligament? Illuminant fibers are found in periodontal ligament. Okay, option D. Question number 12. What type of fibers are principal fibers of the periodontal ligament? Elastic fibers, or reticular fibers, or collagenous fibers, or both collagenous and elastic fibers? Collagenous fibers are the principal fibers of the PDL. 12C. 13. The lactoperoxidase thiocyanate system present in the saliva is against actinomycetes, acetaminophenol, streptococcus, or Porphyromonas gingivalis, or actinomycetes. Okay, so the lactoperoxidase thiocyanate system present in the saliva is mainly against the common organism in saliva, that is streptococcus. Okay. Question number 14. Glucose levels in GCF are equal to the glucose level in the serum, or it is 0 or 3 to 5 times greater than serum level, or more than 10 times the serum level. The glucose level in the GCF are 3 to 4 times greater than the serum level. So option C. Question number 15. The difference in the color between the sub and the supragingival calculus is related to, so there is a difference in color between the sub and the supragingival calculus. Okay, what is the difference? The difference is in the pH of the plaque, the depth of the leukocytes, hemolysis of the RBCs, erythrocytes, or all of the above. The one which causes a difference in color between the sub and the supragingival calculus is the hemolysis of the erythrocytes. Option C. Question number 16. Which stage of gingivitis is also called as subclinical gingivitis? Very easy question and answer. Subclinical gingivitis. Initial stage or advanced stage or early stage or established stage. The gingivitis easily called as subclinical gingivitis is mainly the initial stage. Okay, subclinical. Okay, initial stage. Question number 17. Pyogenic granuloma is granulation tissue overgrowth or non-specific condition enlargement, capillary hemangioma, sarcoidosis, or tuberculoid leprosy. Pyogenic granuloma is actually a granulation tissue, isn't it? So option A is the answer. It's an overgrowth of the granulation tissue. Question number 18. According to the Horning and Cohen staging of oral necrotizing diseases, stage 1 represents what? Okay, according to the system of Horning and Cohen, what is stage 1 in necrotizing diseases? Necrotizing ulcerative gingivitis, necrotizing ulcerative periodontitis, necrotizing stomatitis, or noma. Okay, so necrotizing ulcerative gingivitis is the answer. Okay, option A, that is stage 1. Clear? What is trench mouth is caused by which organism? Okay, easy question. Fusiform bacilli or Borrelia vincenti or both A and B, none of the above. So there is always by seeing the first option itself, you might go and mark the first one. But remember, both the organisms are involved in trench mouth, Fusiform bacilli and Borrelia vincenti. So the option will be C. Question number 20. Resorption of the thick margins resulting in plateau formation is called as crater or ledge or lipping or trauma from occlusion. Resorption of the thick margins resulting in plateau formation. Okay, so the margins are resorbed. There is a plateau formation. It is called as ledge formation. Okay, ledge formation. Coming on to 21. Periodontal disease progression by short burst of destruction followed by periods of no destruction is called as periodontal disease progression by short burst of destruction followed by periods of no destruction. So initially there is a small destruction, then later there is no destruction. Okay, so this is called as what? Asynchronous model or continuous model or random model or slow model. It is called as random model. Question number 22. Periodontitis manifests itself mainly in which area? Molar, upper incisors, both the molars and incisors, and premolar. Periodontitis mainly manifests in molars and incisors. Option C. Mobility of, question number 23. Mobility of the teeth is measured by a periodontometer, a periotron, or spectrometer, or densitometer. Mobility of teeth is measured by periodontometer. Okay. Question number 24. Which one of the following adjunctive aids is necessary to check on deficiency of the oral prophylaxis for young patients? Okay, for young patients, what is the adjunctive used? Disclosing solution, sandpaper strip, Snyder test, or unfaxed flocks? Use of the times you can use a disclosing solution. Okay. Question number 25. In a free gingival graft, what happens to the epithelium? Okay, whether it remains as such, or it proliferates, the epithelium of the graft will proliferate, or whether it will degenerate, or whether it has to be removed by the surgeon. The epithelium of the gingival graft will degenerate by itself. Okay, 25C. Question number 26. Frankel behavior rating system does not include following behavior: definitely positive, definitely negative, positive, indifferent. Okay, Frankel behavior contains definitely positive, definitely negative, and positive. Indifferent doesn't come under Frankel's category. So option D. Question number 27. The success of the calcium hydroxide pulpotomy is determined by formation of the calcific bridge, formation of the hard base to the support restoration, continuation of the root formation, and apexogenesis, all of the above. So there is a tendency for us to mark option D, all of the above. But just closely examine the question. The success of the calcium hydroxide pulpotomy. They are telling about pulpotomy. So the main purpose of pulpotomy is to enhance the root formation. Okay, incomplete the tooth which has not got a complete root apex. So to produce the formation, to encourage the formation of the root formation, you have to give the calcium hydroxide. So that is the main objective. So option C is the answer. Continuation of root formation and apexogenesis will determine the success of calcium hydroxide pulpotomy. Question number 28. Which of the following molar relationship is the most common in primary dentition? That's an easy question, isn't it? Mesial step is most commonly seen in primary deciduous dentition. Okay. 28/29. Potter's arch is recommended as a remainder appliance in children with which habit? Potter's arch is mainly used for lip biting or thumb sucking or tongue thrusting or mouth breathing. Potter's arch is recommended as a remainder appliance in children with thumb sucking habit. Okay. Recommended brushing time in children under supervision of parent is 1 minute. Okay, easy question. For children only you have to brush for 1 minute. Okay. 31. Which of the following groove separates the cusp ridges from the marginal ridges, whether it is supplemental groove, developmental groove, mesiomarginal developmental groove, or marginal ridge developmental groove? Okay, the one which separates the cusp ridge from the marginal ridge is developmental groove. Okay. Question number 32. Calcification of the permanent tooth starts at birth, 6 months after birth, intrauterine, or 10 months after birth. So the calcification of a permanent tooth starts at birth. Okay, at birth. Clear? Question number 33. Soft tissue cyst without radiographic changes. Nasolabial cyst or nasopalatine cyst or mid-alveolar cyst or palatine cyst. The one without any radiographic change, that is a soft tissue cyst, is actually among the options nasolabial cyst. Question number 34. Gardner syndrome does not include, okay, the Gardner syndrome. What are the features of Gardner syndrome? Osteomas, epidermoid cyst, and impacted permanent teeth are features of Gardner syndrome. So the one does not come under Gardner syndrome is osteosarcoma. 34C. 35. Which of the following is the most common developmental cyst? Nasopalatine, nasoalveolar, globulomaxillary, or median palatal? Most common developmental cyst is nasopalatine cyst. Okay. Most common developmental cyst is nasopalatine cyst. Question number 36. The commonest site for carcinoma of the tongue: lateral margin, tip of the tongue, posterior 1/3 or ventral surface. The commonest site for carcinoma of the tongue is mainly, most of the times, the lateral margin. You will find the cancer. Okay. 37. Acanthosis is increase in mitotic division or increase in the thickness of the superficial layer, increase in thickness of spinous layer, disruption of the basal minor. So they have become more specific. Okay, they are just telling not only increase in mitotic division, but there is increase in thickness of the spinous layer. Okay, 37. C is the answer. 38. The following site is the common involvement in cases of myositis ossificans: masseter muscle, hyoglossus, stylohyoid, lateral pterygoid. The one which is mostly affected by myositis ossificans is masseter muscle. Okay. 38A. TENS therapy is useful in myofascial pain dysfunction syndrome, MPDS, trigeminal neuralgia, or facial palsy or neurosis. Most of the times, TENS therapy is given for MPDS, myofascial pain dysfunction syndrome. Question number 40. White radiating lines are observed in case of lichen planus. They are called as Wickham striae. Okay, that is an easy question and answer. Question number 41. Which of the following interactions does not cause film fog? Coherent scattering, transient scattering, photoelectric absorption, Compton scattering. The one which does not cause film fog is actually photoelectric absorption, because it is absorbing. That is why it does not cause any film fog. Okay, it is not scattering, it is absorbing. Photoelectric absorption does not cause film fog. Question number 42. Mark's University of Miami protocol for osteoradionecrosis is related to high-dose antibiotic therapy or hyperbaric oxygen therapy, or both A and B, or none of the above. So the University of Miami is giving protocol for osteoradionecrosis based upon the oxygen therapy given. Okay, hyperbaric oxygen therapy given. Question number 43. Role of fixer. What is the role of fixer in radiograph development? It binds to the developer to the film. It takes away the extra developer solution. It strengthens or fixes the silver halide onto the X-ray film. It removes the extra silver halide which are unfixed. That is correct answer. The role of fixer is to remove the extra silver halide which are unfixed. Okay, removing the extra silver halide which are unfixed. Question number 44. Radiographic technique used to identify the spatial relationship of an object is called as the cone technique, spire technique, ball technique, lamella technique. The radiographic technique used to identify the spatial relationship of an object is called as a cone technique. Question number 45. Least radiation exposure occurs in MRI, CT scan, arthrography, OPG. Least radiation exposure occurs in which among the following methods? In MRI, there is very least exposure. Question number 46. To capture palatal root, the X-ray film should be placed at the median raphe of the palate at a 15-degree angulation to the tooth as close to the tooth on the opposite side of the midline. So it should be placed on the opposite side of the midline to get the palatal root. Isn't it? In case of maxillary molars, if you want to get the palatal root, you have to keep the film on the opposite side of the midline. Okay. Question number 47. A complete clasp assembly means what? What all parts are there in a complete clasp? A retentive arm and reciprocal arm? No. A circumferential arm and a bar type arm? No. Proximal plate and retentive arm? No. Last option you just check. A retentive arm will be there in a clasp. Occlusal rest will be there in a clasp, and reciprocating elements also will be there. So that is the answer 47D. Okay. Question number 48. The tilting of a cast during the surveying in a RPD changes the position of the undercut, path of insertion, amount of undercut, all of the above. If you tilt the cast during surveying in an RPD, okay, removable partial denture, what will change? It will change the position of the undercut, it will change the path of insertion, and also it will change the undercut. All of the above is the answer. Okay. Question number 49. The most recent direct filling gold which produces the hardest surface on the condensation is a matte gold, encapsulated powdered gold, matte gold alloyed with a calcium and wrapped in gold foil, or platinized gold. The most recent direct filling gold which produces the hardest surface on condensation is actually the matte gold alloyed with a calcium and wrapped in gold foil. Okay. The most recent direct filling gold which produces the hardest surface on the condensation is matte gold alloyed with a calcium and wrapped in gold foil. Question number 50. True about self-etched primer. It will remove the smear layer. It does not remove smear layer but binds it to the dentine, increase the dentine permeability, increase sensitivity. What does it do? It does not remove the smear layer but binds it to dentine. 50B is the answer. Okay, self-etched primer will not remove the smear layer but binds it to the dentine. 51. What are ormosers? Ormosers are organically modified or ceramics, inorganically modified ceramics, organically modified GIC, or inorganically modified GIC. From the term itself, it is very clear it is related to ceramics. Then they are asking ormosers. Okay, ormosers means organically modified ceramics. Short form of organically modified ceramics is ormosers. Okay, 51A. 52. The primary goal of the caries prevention are all except, okay, the question is except the primary goal of caries prevention, limiting the pathogen growth and altering the metabolism. Yes, that is a goal. Increasing resistance of tooth surface to demineralization, that is also a goal. Increasing a biofilm pH, that is also use of probiotics. No, it doesn't come under caries prevention. Okay. The primary goal of caries prevention are all except use of probiotics. 53. The C-shaped canals are found most commonly among which option given? Mandibular first molar or mandibular second molar, or maxillary first molar or maxillary second molar? The C-shaped canals are most commonly found in mandibular second molar. Okay, remember this, most commonly seen in mandibular second molar. Question number 54. Pulpal inflammation is marked by peripheral vasoconstriction, strangulation of the pulp, increased vascular permeability, and increased. Whenever there is an inflammation, there will be increased permeability. So 54C. Barbed brooch is used for, easy question, barbed brooch is used for what? Extirpation of the pulp or enlargement of the canal, obturation of the canal of the barb. Okay, it is mainly for extirpation of the pulp. 56. Setting time of the mineral trioxide aggregate, MTA. What is the setting time of MTA? It is very high, more than 2 to 3 hours. Okay, not short. Mineral trioxide aggregate will take very long time to set, more than 2 to 3 hours. 57. The best way to monitor perfusion of the free flap is by using a pulse oximeter or laser Doppler flowmetry or prick test of fluorescence. Okay, so how will you monitor the perfusion of a free flap? By doing a prick test. Okay, the best way to monitor the perfusion of the free flap is by a prick test. Question number 15. Which of the following is not a uridopenicillin? Piperazillin, meslocillin, acylocillin, flucloxacillin. Which of the following is not a uridopenicillin? Okay, that you have to by heart. Flucloxacillin is not a uridopenicillin. Piperazillin, meslocillin, acylocillin, all of them are uridopenicillins. Okay. 59. The highest risk associated with the use of oral contraceptive. If you use every time oral contraceptive, what is the side effect? Hepatic necrosis, permanent sterility, thromboembolic disorders, cancer of the breast. Most of the times you will get thromboembolic disorders if you use what? If you use contraceptives. 60. An anxiolytic not interacting with the GABAergic system and used in generalized anxiety is alprazolam, diazepam, buspirone, phenobarbital. Okay, an anxiolytic not interacting with the GABAergic system and used in generalized anxiety is what? Buspirone. Okay, option C is the answer, buspirone. An anxiolytic not interacting with GABAergic system and used in generalized anxiety. Just remember this way, that whenever you get a stress or anxiety, the drug prescribed is buspirone. Okay, buspirone. 61. Therapeutic index is what? LD 100 by ED 100 or ED 100 by LD 100 or LD 50 by ED 50 or ED 50 by LD 50. Therapeutic index is 50-50. Okay, remember that way. Therapeutic index is 50-50 always, not 100-100. Therapeutic index is 50-50. LD 50 by ED 50. Okay, 61C. LD 50 by ED 50. Therapeutic index. Question number 62. A restorative material which has a high proportional limit compared with one with a lower proportional limit would have what? If one material is having high proportional limit, means it has got more resistance to permanent deformation. Okay, not great ductility, not great toughness, not high modulus of elasticity. It just means it has got more resistance to permanent deformation. Okay. 63. Vulcanization refers to the setting of reverse hydrocolloid, mercaptan impression material, zinc phosphate cement or zinc oxide eugenol. Vulcanization refers to the setting of what? Mercaptan impression material. 63B. Vulcanization refers to the setting of mercaptan impression material. Vulcanization refers to the setting of mercaptan impression material. 64. Chronic mercury toxicity results from ingestion while removing the old amalgam, skin contact, mercury vapor, all of the above. All of the above will cause mercury toxicity, isn't it? 64D. 65. Chromium is added to the stainless steel as it provides sensitization, corrosion resistance, stabilization or hardening. Chromium is added to stainless steel as it provides corrosion resistance. Okay? Clear? 66. Passivating layer on alloy is dissolved completely by basic acid, borax, potassium fluoride or graphite. Passivating layer on alloy is dissolved completely by using what? Potassium fluoride. Okay, 66C. Passivating layer on an alloy is dissolved completely by potassium fluoride. Type 1 GIC is used as a sealant, a luting, or restorative or liner. Very easy. Classification of GIC you have to study very hard. Type 1 GIC is luting cement. Okay. Type 2 is restorative. Okay. 68. New monomer that improve the clinical properties. Silurine, siloxane, silanes or silocanes. New monomer that will improve the clinical property is silorane, which that is a new monomer, okay, used in clinics now. Silorane, okay, new monomer that will improve the clinical property is silorane. Question number 69. Hinge axis is located with the help of ear rods, maxillomandibular vertical relation, kinematic face bow or orbital point. A hinge axis is located with the help of a kinematic face bow. 69C. 70. Sibilant sounds are produced at rest position, occluding position, open from the rest position, between rest and occluding position. Sibilant sounds are produced between rest and the occluding position. Okay. The sounds which are produced between the rest and occluding position is called as sibilant sounds. 71. Patient with complete denture complains of pain while swallowing and there is overextension of the distolingual aspect, which is the muscle involved. Whenever the patient is having food, the patient is wearing a complete denture, and the denture in the distolingual area there is an overextension. So what is the muscle involved in this area? Superior constrictor, palatopharyngeus, palatoglosssus or stylopharyngeus. Mainly superior constrictor is involved in that area. So 71A. 72. The frequency of a disease or characteristic expressed per unit size of the population or growth in which it is observed is rate, ratio, proportion or average. The frequency of a disease or characteristic expressed by unit size of the population or a group in which it is observed. Okay, so how much frequency of disease is expressed in a particular population? Okay, so that is expressed by rate. Okay, option A, rate. The rate at which a disease is spreading in a population, like that. Okay, 73. Fluoride action on carbohydrate in reducing the caries is by inhibiting enolase, inhibiting fructose, inhibiting sucrase, inhibiting glycolase. Fluoride acts on a carbohydrate by reducing what? By inhibiting enolase. 74. Root caries index given by which scientist? Root caries index is given by Ralph. RR. Remember RR. Root caries index is given by Ralph. 75. Structures passing through the foramen spinosum. Accessory meningeal or middle meningeal or mandibular nerve or maxillary nerve. Middle meningeal artery passes through foramen spinosum. 75B. Middle meningeal artery passes through foramen spinosum. Okay. 76. Jugular omohyoid lymph node drains the middle ear, anterior scalp, the tongue and upper face. Mainly the tongue is connected to jugular omohyoid. 76C. Retromandibular vein is superficial to the facial nerve. Within the parotid gland, drains the pterygoid venous plexus through the maxillary vein, forms the external jugular vein through its anterior branch, drains into the deep facial vein. Retromandibular vein is superficial to facial nerve? No. It drains the pterygoid venous plexus through the maxillary vein? Yes. That is the answer. Okay. Retromandibular vein will drain the pterygoid venous plexus through the maxillary vein. 78. Which of the following is not a branch of ophthalmic nerve? What are the branches of ophthalmic? Frontal, maxillary, frontal, lacrimal and nasociliary. These are the branches of ophthalmic. So one which doesn't come under it, medial ethmoid. 78D is the answer. 79. Branchial fistula is persistent of first branchial cleft, first branchial arch, second branchial cleft, second branchial arch. Branchial fistula is persistent of what? Second branchial cleft. 79C. Branchial fistula is persistent of second branchial cleft. Question number 80. The lingual surface of the epiglottis is lined by stratified squamous epithelium, simple squamous epithelium, stratified columnar epithelium, pseudostratified epithelium. The lingual surface of the epiglottis is lined by stratified squamous epithelium. Okay? Remember that. Stratified squamous epithelium. Question number 81. 45 chromosomes are seen in which syndrome? Turner syndrome, Down syndrome, Nennogenesis imperfecta, Treacher-Collins syndrome. The 45 chromosomes are seen in Turner's syndrome. Okay? Turner syndrome. 82. Pacinian corpuscles are major receptors of pressure. Okay? Very easy question and answer. Pacinian corpuscles are major receptors of pressure. Okay? 83. Which of the following clotting factors involved only in extrinsic pathway? Clotting factor 9, 10, 2 or 7. The one which is involved only in extrinsic pathway, not in intrinsic pathway, is factor 7. Okay, rest all the three given options are involved in both intrinsic pathway and extrinsic pathway. 7 is not present. Okay, coming on to 84, calcitonin is released by parafollicular cells of the thyroid, chief cells of thyroid, granular cells of adrenal gland, stratum fasciculata of the adrenal gland. Calcitonin is released by mainly parafollicular cells of the thyroid. Okay, calcitonin is released by parafollicular cells of thyroid gland. Okay, 85, osteoclasts are inhibited or modified and regulated by parathyroid hormone calcitonin 125 dihydroxycholecalciferol tumor necrosis factor. Osteoclasts are inhibited or modified and regulated by calcitonin. Okay, calcitonin. Osteoclasts are modified or regulated by calcitonin. 86, platelet function is assessed by bleeding time, clotting time. Platelet function is mainly assessing what? Bleeding time. Okay, 86A. 87. Vital staining was introduced by Enlow, Wolf, John Hunter or Petrovic. Vital staining was introduced by the scientist John Hunter. Vital staining was introduced by John Hunter. 88. Value of mandibular plane angle is what? So you have to by heart this. The mandibular plane angle is around 17 to 30. Okay, 17 to 30. 88A. Which of the following orthodontic wire has least modulus of elasticity? Knit tie, beta titanium, stainless steel or cobalt chromium nickel. Okay, knit tie wire has got least modulus of elasticity. So 89A. The best time of extraction in pregnancy is second trimester. For all the dental treatments, the best time is mainly the second trimester. 90B. 91. Sensitivity to local anesthetic is greater in type B fibers or type C fibers or A delta fibers or fibers supplying the muscle spindle. Sensitivity to local anesthetic is mainly for type C fibers. Okay, sensitivity to local anesthetic is greater in type C fibers. Trismus during block anesthesia is as a result of massive edema, damage to medial pterygoid, damage to lateral pterygoid, damage to inferior alveolar nerve. Trismus during the block anesthesia is as a result of damage to medial pterygoid. Damage to medial pterygoid. Trismus during the block anesthesia is as a result of damage to medial pterygoid. Okay. 93. Forceps used for maxillary fracture disimpaction. Rouse, Bristow's, Ash, Avolshams. For maxillary fracture, you use a Rouse disimpaction forceps. 94. 93A. 94. Incision given within hairline 45 degrees to zygoma is Gillies temporal, Alcat Bramley or Riston or Mori. Incision given within hairline 45 degrees to zygoma is what? Gillies temporal. Okay, incision given within hairline 45 degree to the zygoma is Gillies temporal incision. 94A. 95. Which surgical procedures carried out to treat TMJ ankylosis? Arthroplasty, condylectomy, discoplasty, capsulohermy. The one which was carried out to treat TMJ ankylosis is arthroplasty. 95A. Arthroplasty. 96. Which of the following is not a sclerosing agent? Not a sclerosing agent. Okay, so you have to double check the question. Sodium silate, sodium morate, sodium tetragonal sulfate or sodium bicarbonate. Which of the following is not a sclerosing agent? Sodium bicarbonate is not a sclerosing agent. Okay, rest everything. Sodium silate, sodium morate, sodium tetragonal sulfate, all of them are sclerosing agents. So 96D. 97. Incision for drainage in Ludwig's angina extends up to the neck, up to the angle of the mandible, floor of the mouth or all of the above. The incision for drainage in Ludwig's angina is extending in the floor of the mouth. Okay, 97C. 98. Duct of Rivinus is associated with parotid gland, submandibular gland, sublingual gland minus salivary gland. Duct of Rivinus is associated with sublingual gland. Okay, 98C. Sublingual gland. Duct of Rivinus. 99. The mucosa of the posterior third of the tongue is supplied by facial nerve, trigeminal nerve, mandibular nerve, glossopharyngeal nerve. Okay, the one which supplies the posterior part of the tongue is glossopharyngeal nerve, mucosa part. Okay, mucosa part of the posterior third of the tongue is supplied by glossopharyngeal nerve. Last question. The carotid sheath contains all except vagus nerve, internal carotid artery, common carotid artery, external artery. The carotid sheath contains what? It does not contain external carotid artery. It's easy question. The carotid sheath contains vagus nerve, internal carotid artery and common carotid artery. It does not contain external carotid artery. Okay. So with this we come to the end of all the 100 questions. So this is a model paper for Kerala PSC exam which contains 100 questions. So you have to solve the questions. You have to first check the question, double check the question, take the clue from the question. From that clue, rule out the options, then take the odd one out. And if you have a doubt, you have to read once again and you have to cross check your answers. Okay. And if you find any difficulty in getting the explanation for any of these questions, please do comment below the video. I will reply soon. Okay, so see you for the next time. Please do subscribe the channel and also revise the video again and again. You can see rest of the PSC papers in the playlist. Okay, in the playlist of the eDental Formula YouTube channel. Okay, so wait for the next video. Till then, bye bye. Thank you.